Your child was diagnosed with a hearing loss. Now what? I'm Dr. Lilach Saperstein, an educational audiologist, and my passion is empowering parents of children with hearing loss and all family members affected by hearing loss with what is your role and what are your options. So in this series of videos, I'd like to talk about first acknowledging what this is, and understanding that there is a grief process when a diagnosis such as hearing loss or deafness is given to a child for the whole family. And many times that grief process is overlooked and not attended to, and there's the first step is often a denial. At the same time, there's a big sense of urgency in terms of implementing interventions and helping the child, but before there's even been an understanding or an acceptance of the situation itself. So I would like to commend you for clicking on this video, for coming to watch this series, and for being the support that your child needs and becoming the advocate that they so desperately deserve, because you're the one, you the parent or the caregiver of a child with a hearing loss are an incredibly important person in their journey and your journey, because this is also about you. I feel that one of the biggest issues surrounding children's hearing loss is that parents are not guided and supported enough for their own experience. If your child is diagnosed with a hearing loss, this is often unexpected news, and most of the time children who are born deaf or with hearing loss are not born to deaf or families with hearing loss. They're born to hearing families, and it can be a big shock, a big surprise, and also a big learning curve of what is this? What do we do? What are our options? What does this mean? There's a lot of questions and confusion that comes along with any diagnosis. In addition, there's a big sense of urgency that comes with hearing loss, because there are such great interventions that you want to implement them right away and get as much as you can, in terms of the success of those interventions. But at the same time, there's some sense of urgency before there's even acceptance or understanding of what's happened because of the time crunch. So the first thing I want to say to you is that I see what you are seeking, and I commend you for seeking it. A little bit of support, a lot of information and understanding, and some guidance. Often one model is being presented, which is, this is what you need to do, this is when we're going to do it, these are the things that have to happen, in terms of, let's say, cochlear implantation, where if there's a deafness diagnosis, we have a time crunch, see the team, do all the testing, and get to the surgery, and then implantation, and then activation, and there's like a lot happening. But I want to tell you that if you're in that stage and you feel pressured and you're feeling overwhelmed with decisions being made for you, that you have the power and you shall be empowered to say, wait a minute, let's get all the information and make the decision together. In medicine, there's a model called shared decision making, and this means that the health professional, audiologist or the ENT or the surgeon or whoever it is who's talking to you, is meant to provide you with all the risks and benefits, all of the potential outcomes, and that you together make the decision that's best for you and for your child. I'm not saying that one decision or another is right or wrong for anyone. That's exactly the point, that we need to have the time and the information and the support to make the best decision. So first of all, let's take a deep breath. And truly acknowledge that this is hard. Many times there's a grief process here, and you have to also let yourself grieve for the loss of what you expected for your child, what kind of parent you thought you would be, and what are the demands on you now as a parent of a child with a hearing loss, or any kind of health issue for that matter. So I would like to really acknowledge you. Okay, that's the first thing. Now the second thing that I think is missing is more information and really an understanding of what the diagnosis is. What is happening? What do all these words mean? All this medical jargon, all these reports from the audiologist, what do they mean? And that's something that I really feel very passionate about, that patients should understand what is happening, most especially parents of young children and infants dealing with hearing loss, because there is a lot of misunderstanding. I think that it's due to the fact that there's just not enough time for every audiologist to sit with their patients when they have a full schedule, and they need to take the action steps as well. So that's why I thought that there's a need for these kinds of videos and this kind of space online for us to come together and really be able to delve into what are the implications, what are the words, help me read this report, and like what all those words and terms mean. So understanding the diagnosis, the type of hearing loss, the degree of hearing loss, the configuration of the hearing loss, these are all things that are individual to each case, to each child, and understanding your specific child's needs comes from understanding what their diagnosis is. And the third thing that I think is very, very important is understanding the options and what are the intervention options being presented to you, and perhaps what intervention options are not being presented to you, or you're not aware of, or you have not been exposed to, and seeing also risks, benefits, pros and cons, potential outcomes for all the different things that can be done to support children with hearing loss and to aid them in the goals, whatever the communication goals that you have for them. And in fact, that there can be different sets of communication goals than the ones that are being presented to you. In this series of videos, we'll be discussing a lot of things, and I welcome you, and I'm enthusiastic to see your comments, and that down in the comments we can all help one another. You can join the group, and we will do a lot of good learning, information gathering, support, and guidance. So welcome.